means. Don't know what procurement means. Give me number one. If you do know what procurement means, give me the number two. And by the way, also let me know where you're located. Hey, Angel. Also let me know where you're located. And this is not, I'm not going to be doing like a full training on healthcare government contracts, but I do want to share from my experience today. And then you guys are going to see some things on my stories, on my reels. Hey, Oregon, hey, Ohio. You're going to see some things that it's going to put some of these pieces together. But I just had to get it out, and tell you what's going on. So first, my name is, for those of you who are just joining me for the first time, my name is Sean, aka the Sappy Business Chick. And again, today I went to a procurement opportunity event. Now, to give you some foundation, because I don't want you guys to be lost, procurement in the contents of government contracts, it refers to a process by which the government agency that is looking to contract with people, it's like a store. Like this is like Sean's version. It's like a store. They're looking to acquire goods, services, products from a private business. So remember, it's the government looking, going shopping per se. It's their procurement is like they're shopping. They're going shopping and they're looking to purchase goods or services from private businesses. Hey, how are you? And the procurement process is a fair and transparent and also competitive way that the government does this. Now, if you've heard of government contracts, give me the number one. If you've heard of government contracts, give me the number one. If you kind of know about government contracts, but you're not really sure, give me the number two. You've heard about government contracts, okay? Again, I wouldn't even be able to go into depth of healthcare government contracts with you on this on this live, because it would just actually take a little bit too long. But me, myself, and I, one of my home healthcare agencies, had about 5 healthcare government contracts. 5. And they all went through this process, right? Okay, so I gave you the definition of procurement. Now, okay, so this is how the procurement works there, and this is part of what these companies that I'm going to mention were doing today. Okay, there is, and if you're on TikTok right here, I'm looking for, because this is YouTube, right? So I decided to get on the same time. So a government agency identifies a need, right? And if you are in my home care Kickstarter or Next Step program, we talk about how you even set your business up to address needs. And if you are taking any notes and you never really heard that before, I want you to write that in a comment. I need to address a need or problem. I need to address a need or problem. If you're taking notes, you guys know they say that note takers are money makers. Steph, in this instance, we're not talking about Medicaid and the VA, but those would be a government company. But in this instance, We're not talking about the so thank you for asking that question. I'm going to give you an example of one of my healthcare government contracts. Guess what? It was with the school system. Totally Sean, with the school system? With the school system. So even though Medicaid and the VA are federal government and state government programs, I see where you're going, but this is not what we're talking about today. Got it? All right. So how the government works, I'm just going to briefly go through this step by step. Okay, there's a need identification. And remember, guys, you're meeting a need. And boy, did we really go over this last night in the Home Care Kickstarter program. You're addressing a need. The government agency identifies a need, right? So let's say, for example, they have a need for medical staffing, right? Let's say they have a need for software. You're IT person, but you specifically develop software for medical related stuff. They have a need for in-home nursing, right? They have a need for nursing in general. They have a need for nurse training, right? These are just examples, but they identify a need within their company. Next, what happens in the procurement process is that there is a solicitation is issued, right? The solicitation is issued. It is either done as a RFP. These are RFPs are the kind of things that I responded to. And again, if you are following along, I want you to put it in the comments. I want you to put RFP in the comments and let me see it so I know that you're following along. RFP. And then I'm going to tell you what that does. All right. RFP stands for Request for Proposal, right? And the RFP focuses on solutions and expertise. Solution and expertise. So when they're looking for the experts and they're looking for the solution to their problem. An RFQ focuses on pricing, right? They're looking for the best price for an existing issue that they have. And so that's where the most of the focus is on the price or the cost of delivering the service or getting the best deal for this product or good. And then lastly, which they talked about during this procurement opportunity, was a IFP. IFP stands for invitation for bid. And invitation for bid addresses the lowest price. The lowest price may win, along with specific requirements. Congratulations. Okay, so those are your terms for the day. All right. Those are your terms for the day. And this is a CEO session, right? This is not a session for nurses. It's not a session for healthcare providers. It's not a session for administrators. It's a session for CEOs because CEOs and presidents would have attended the event that I was at today, right? Why? Because CEOs, presidents are visionary, right? We're always looking for opportunities. We're looking for ways to be working on our business, not in our business, right? Right? Be looking for ways to be working. Look on our business, not in our business. Okay. So those are your terms. And every Sunday, I give a home care terminology on my Facebook page, right? So you should follow that. Every Sunday, I'm giving you a terminology. I even have it in my Next Step program and my Kickstarter program. You need to know terms so that you can understand what you're doing, right? So this has to do with healthcare government contracts and just government contracts in general. Okay. Okay. Then the next step after we have the need notification or an identification, what is sent out from the organization, the government organization, then it's a solicitation, and that's when you're going to either submit these three different types of proposals: RFP, RFQ, or IFP. That's your response, right? That's your response. Your response isn't verbal, it's written, and these formal proposals, right? Then the vendor response, the business, which would be like your agency, submits a bid on proposal, and it's gonna and your bid usually needs to explain what you will be providing based on their need, how you will deliver it, pricing, and the qualifications and compliance of your business. I'm going to repeat that. What you will provide, right? So if they have a need for medical staffing, then you need to say, "Hey, we can provide nurses, CNAs, CMTs, and we can provide nurse practitioners." It has to be stated, right? Because it's a proposal. How you will deliver it, right? So then that is your plan. Remember, I'm always telling you guys, no shortcuts, no short sentences, no short paragraphs. It needs to be detailed. Your pricing, a lot of you have a problem with pricing right now for your private pay clients. So your pricing needs to be good so that you don't underbid, and then you are getting paid by the government too low or overbid, and then you don't win it because you're too high. Okay. And then the last phase is evaluation and award. Proposals are reviewed by the procurement department based on criteria such as cost. How much is it going to cost for that government agency and your business to use your agency, your company to provide the service. Past performance. So if you are a returning contractor, what's your past performance? I have said this before. Most of the time, especially if you are in a regulated state, it is not very likely that you will ever win a healthcare government contract in your first year. Why, Sean? You don't have any history of business. You don't have any history. You don't have any business history. And this is why I'm always pushing you guys, go out and get some flip-flop clients. Go out and be operational, right? They're going to be looking at that, right? They ask for financials. They ask for plans. Okay. So past performance could be either one. Compliance. Are you in compliant with their requirements? Capability. Are you capable of handling this $5 million contract? Right. And we need to staff 25 medical staffing or XYZ. Are you capable of doing that? And then here is something that's changed. Now, I went to a healthcare government contract. Well, actually, it was just basically a government contracting conference 2 years ago. Everybody say two. I went to this 2 years ago. This is before what happened in the fall. What happened in the fall is we witnessed a lot of DEI programs being stripped before our eyes. We looked at it and we were like, oh my God, what am I going to do? Right? We witnessed that. But 2 years ago, this is why I'm always telling you guys, I am, God has blessed me to be like a forerunner. People who are in the government contracting sector literally told us affirmative action, skin color is no longer a factor for getting contracts. Everybody was surprised. And so they literally said, now, for those of you who don't know, I am in the DMV, right? So when I talk about government contracts, at that conference, it was on the federal and state level. So just to give you a good balance, even though it may not be in Texas, even though it may not be in Oregon, just to give you a good balance that these are individuals who are in those contracting offices. They're saying, don't lead with that anymore because it doesn't work. Actually, it hasn't been working for a while. So a lot of us were surprised when they saw DEI stuff just being stripped, right? Was being stripped. But guess what? In the background, it's been happening all along. It's been happening all along. So your award may not be determined by you being woman owned. Should you still promote that you're woman owned? Absolutely. Absolutely. Should you still promote that you're veteran owned? Absolutely. And I've said this before. I prefer you put woman owned before black owned. It has a heftier weight in the marketplace. Don't like my advice? Fine. I've been doing this longer than you, right? So I'm not saying don't state it, but I am saying it's not your it's not the icing on the cake anymore. Okay? Okay, so why procurement matters for small businesses. Procurement is how some small businesses, if they know about it, can legally access government money. All right? They can legally access government money, right? Now, if you are a newbie, let's say you're a newlywed in your home care agency, and I'm going to call you a newlywed if you are under 3 years old, right? I'm going to call you if you're first year, second year. I'm going to call you a newlywed. I'm going to call you a newlywed if you're under 3 years old. Why? Because I have a lot of people that join my home care or my next step program in business a year, 2 years. Got some clients, don't have any systems, don't have any structure, don't have any strategy, still figuring it out. That would not be to your advantage to go after a government contract with if your operations is or infrastructure is not good. You would not do good on that contract, right? Because that's not the time to figure out infrastructure. That's not the time to figure out systems. I know you're like, but if I have more money, I can hire somebody that can do all that. No. Once you get awarded a contract, and they even said it today, you have to start servicing that contract. Because you told them in your capability statement, I am able to do this. I'm able to supply, like I said, for me, my first healthcare government contract, supply nurses in the school system, right? So I supplied nurses in the school system, and what did I have to know? How many schools are they? How many schools are they? We got elementary, we got middle school or junior high school, we got high school. How many schools are they, right? Dang, y'all got 500 schools? Am I able to supply 500 nurses? Okay. All right. So procurement is how small businesses legally access government money. The government is reliable, right? You see my quotations? And they can be a high paying client, right? The government gonna want you to put everything together. Make sure you included overtime. Make sure you included holiday pay. Make sure you include everything, because we don't want you coming back to us saying, oh, by the way, we forgot to put that in our contract. No. A lot of these contracts can be multi-years. I heard it mentioned today, they had some 4-year contracts. Many opportunities are they purposely set aside opportunities for small businesses. And it used to be that they would set aside opportunities for minority-owned businesses. And not to say that they're not, but they have to have fair ruling. And right now, underneath the current administration, so a lot of that language cannot be used. Okay. A lot of government contracts are paid in advance, right? So if the contract is awarded, then the money is allocated. It's allocated, right? Okay, we said this contract is $5 million. It's already allocated, right? One thing that was said today that I thought was very, very interesting, and I'm getting to why I jumped on here. One thing I said today that was very, very interesting. First, the two main companies that I'm going to share with you today, what they said, both of them were not medical or healthcare companies. Both of them were not medical or healthcare companies, but both of them mentioned that they have nursing, that they have health and safety, that some of their workers have to get like a physical examination that's done by a nurse, that they have they may follow OSHA requirements, which falls heavy on healthcare. And what was the other thing that sparked my interest? So they basically said, hey, you may think I'm an electric company, which one of them was an electric company, but guess what? Ask me, and I will tell you that we have programs for things that's not necessarily listed, right? So they have programs for that. So that means that you need to be in some rooms where there are different kinds of opportunities. So you would be wrong to say, I'm not going there because that's an electric company. How could they help my medical or non-medical home care or home health care agency? So we're not going to make any assumptions in 2026 and beyond, right? Because if you're really trying to position yourself for those opportunities, then you go where the opportunities are. So another thing that they mentioned is that once you are awarded a contract, that there could be times of where everything is moving and you're meeting, you're servicing the contract, and then they can have a slow period. So what that said to me is, still, like I've been telling you guys, don't put all your eggs in one basket. I've been saying that about Medicaid, I've said, if you're Medicaid heavy, you should not put all of your eggs in the Medicaid basket. And he clearly said, don't have diversity so that when things are slow, you're not like, oh, where's the work? Where's the work? Where's the work? Because you're looking to, be able to bill. And here's the thing, it's a contract, right? So if the contract is 5 million, guys, it's kind of similar to like having a Medicaid client. If the contract is 5 million, but you don't work, you can't send out a bill if you're not working, if you're not servicing the client with your product or goods. Same thing with like if you're in some of the colder states and let's say it snowed and you missed going to that client's house to provide service because you couldn't get someone to go out there. Guess what? You can't bill for that day. So you want to keep your options open. All right. So number one, look for this in 2026. I need you guys to be more diverse, right? Now, Sean, what if I am just starting? I'm not quite 1 year old. I'm not quite, or I'm 1 year old, but I'm not 2 years old. And you said, don't really start this until maybe 2 to 3 years old in my business. You can start positioning yourself, right? You can start positioning yourself. And this is something that came up at this procurement opportunity event. I'm sharing this with you now. This is something I actually shared with my mentees in my WhatsApp group. January is a good time for you to be out networking. January is a good time for you to be out networking. Now, do you know what networking actually is? If you feel like you know what networking is, give me the letter Y. If you're not sure or you just don't know what networking is, give me the letter N. Okay. All right. So networking events are when you really need your business cards, right? All right. So technically, this procurement opportunity was a networking event. I made no sales there. All I made was contacts, but key contacts with decision makers or people who can connect me with decision makers, right? Networking events are not necessarily where you're selling your service, right? This is not where I bring my brochure and I say, hey, I am a home health care agency, and I have a compassion about seniors or people with dementia, blah, blah, blah. That's not that place. Networking is a skill, and it's a skill that you should develop, because when you're networking, another skill that you need to develop is reading the room, right? So God gave us 2 ears and 1 mouth. One of the things I did is I listened. And there were maybe 4 or 5 presenters. And the presenters that said, basically they said, look for other opportunities within our company. Those are the ones I went to first. And then I kind of restated something that they said was important to their company, right? Right. So what they said is, you can contact me and I'll connect you with these program managers that can get you into getting a contract. And this one particular company said that um, like basically they contact you whenever they have a contract or proposal. So what what networking does, what I did is learn more about the person I need to connect with. Networking is a form of marketing, but what makes it different is that you're not directly marketing, sales presentation, um, drilling in, use my company. You know why? Because they may be a part of the decision process, but there is no um right at the time that you're meeting them, there is currently no um contract on the table, right? It's like there's no contract on the table, but if if there becomes one within the next week or the next month or next year, that's the person that will help me obtain it. So networking is also a form of relationship building. At networking events, uh, they're organized gatherings, and this one, I drove down to Prince George's County, Maryland, and it was held by the Economic Development. It was done by the Economic Development department, right? So that's who the event was hosted by. It was an organized gathering. Um, you should have a way that you introduce yourself. Most people do not have a way, they don't know how to introduce themselves other than calling themselves an owner, right? Of course, you're going to have some kind of exchange of contact information. I did not hand out any business cards. I took information so that I can be the one to follow up. I just have a different strategy than most people. All right. And essentially, you're there to learn. During the networking, you're there to learn about opportunities, contracts, build referrals, build partnerships, and heavy on the partnerships. So for us in home care, home health care, we are usually marketing to our referral sources. In a networking event, we're trying to build partnerships, right? Okay, yeah, you know what? You should go over there and talk to her. You should go over there and talk to him. They'll help you with XYZ. Okay. All right. So places where you can go to do some networking events, especially in the month in like the first 2 months of the year. Um, your Chamber of Commerce, small business expos, women in business events, minority business networking events. Um, try to go to as many as possible, right? Um, try to go to as many as possible. Just go there and saturate yourself with other business people who are also looking for opportunities. And remember, I said step outside of your comfort zone. You don't always have to go to ones that are healthcare or medical related. Other places where people do networking is at healthcare conferences. Now, we have some healthcare conferences we have some healthcare conferences that are coming up, but some of the ones that we have for our industry are more so like teaching you how to do something. The kind of healthcare conferences that I used to attend was truly to put you in the room with other business owners, administrators, executive directors, and you were truly coming together to be more compliant, figure out how to grow your business, be up to date with the trends. This is how I really perfected my knowledge of developing um, developing uh, policies and procedures, right? Because we had an attorney at a healthcare conference I went to. I was showing this last night in the Kickstarter Next Step, right? I have the certificate of completion from, of all places, the California Association of Health Services. Back then, I'm telling my age, this is 2008. Back then, and even now, they don't have home care and home health care administrator certification programs. That is a home care certification program. Now they have healthcare administration, but healthcare administration in your university doesn't necessarily cover home care. If you think about it, it doesn't cover home care. It can cover healthcare facilities, but not home care or home health care. All right. So you want to go to those healthcare conferences, healthcare or senior expos, hospitals or facilities, if they have an event, which they don't often have, but if they have a networking event, I've gone to balls. Like I went to like a ball for neurologists, neurologists, where a lot of doctors were, and that's how you network, right? And your goal for networking is to build partnerships. Partnerships can help you directly or indirectly. If they can't help you directly in the form of a referral, then they can help you indirectly by pointing you in the right direction. Okay. So here is again what I gleaned from this, and I wish I could play it. Wish I could play it. I don't think it's on my thing. Oh, battery is low. Wow. Do I have it up here? Let me see. Okay. Do I have it up here? Let me see. Um, um, see if I can find this. You guys have any questions? Let me know while I'm looking for this. See if it will connect with my other phone. Okay, I guess I'll just put it in my stories. Hey, Palumi, if you're still here. So I'll just put it in my stories. Okay. Something. Any questions? Any questions? I wanted to play it. I should have used my other phone. Wanted to play it while we were up here, but it's not gonna let me do it because they're not connected. These are two different phones. Any questions? You have several. Come on. Do you want it on the collard greens? I feel like Jill Scott after you said you got questions. Okay. Okay. Nurse Taylor.
So, I already have a EIN, business name, and all that fun stuff. I have, first of all, hi. So, and I already have the policy and procedures
For what state?
for North Carolina.
Okay.
So I am, that's where I'm stuck at. So how do I progress past that?
Have you submitted your application?
Yeah, I submitted everything to the state, and then what she told me was that I needed to do policy and procedures and get that all back to her within a year, which my year is approaching. I think it's next week, but I had another lady help. Well, she was supposed to be helping me, and she just kind of like took my money, and that's where she stopped.
Mm-hmm.
So,
Bro,
and she never, like, she was supposed to be like telling me what she was doing, all that stuff, and showing me how to get the business off the ground. But she never did. But she pretty much took my deposit and did what she did with it.
okay. Sorry to hear that. So you have a decision to make. Do I restart all over again? Right? Because if you restart all over again in North Carolina, you're going to have to take that class all over again.
Right. And that's not what I want to do.
Right.
But
And
my year is coming up, so
then you can get, we have a DIY kit for North Carolina. I mean, what's your budget? I mean, I don't know. You kind of haven't asked me a question. You just told me what's wrong.
my question is how do I progress, or what do I do to? What's the next step after all of that?
Well, you can't even get past that. You got to get licensed first. I don't want to talk to you about starting to market your business when you're not even licensed. You got to address that first. Am I wrong?
No, you're not wrong.
Okay, we got to address that first. We can't just push that aside because how long ago did you start working with this lady?
I've been working with her. I was working with her as a nurse, and then I was like, hey, that's something I would like to do.
Okay, but I'm saying how long that she has been supposedly getting you back your stuff?
For like a year. Like
Okay.
it'll be a year next year. Next week, I'm sorry, next week it'll be a year.
And okay, so you haven't heard from her since?
No.
Okay.
I haven't heard from her since like September.
Okay, and you still don't, is it a budget thing that you can't get your
No, it's not a budget thing. It's she stopped responding.
but I'm just saying now, is it a budget thing for you to get your policies and procedures done?
No, it's not a budget thing. I just don't know what to do next.
You got to get your policies and procedures done so you can get licensed.
It's done, so I could just send my policy and procedures to North Carolina, to the state of North Carolina.
They are done. I'm confused. You said she took your money. She didn't
Right.
finish something. So I'm confused. You have the policies and procedures, or you don't?
I have a policy and procedures.
But I thought
It's one that I created. I'm not sure if it's correct.
Is that the one the state said to correct?
No, I never sent mine to the state, and she never sent the
Oh.
one that she was supposed to send to the state.
Okay. Okay. So, okay. I would prefer to answer your question about what to do next after you are licensed. I don't think that's fair for me to tell you and get you excited about what you can be doing after your license when you are not.
Okay, I should do.
It's not fair for me to talk to you about that because it's nothing you can do about it. There's nothing you can do. That should be like that's just a priority. Get that done. How long have you had the policies and procedures?
I just finished it like last week.
Okay, cool. So you got to submit that as soon as possible because, like you said, your year's about to be up, and then you don't want to have to start all over again. I know, Coach Cola. There are a lot of people telling me that they have been scammed in the starting a home care or home health care agency, and I hear it at least 3 times a week. So you saying Nurse Taylor and then Coach Cola in the comments, people paying stuff and didn't get anything done. I understand. At the same time, we can't let that, like the magnitude of Nurse Taylor starting all over again, like it's more expensive to start all over again versus starting from where you are. So I don't know how to encourage you guys to vet out these coaches or mentors or whatever they're calling themselves out. I mean, I get on here all the time, sharing on Facebook, on TikTok, on YouTube, and a lot of times you guys will share, hear me tell you things that no other coach consultant is talking about, and you'll go with another coach or consultant. I'm not offended. But if you come back to me, you say, "Oh, I should have listened to you." I mean, it's nothing for me to do. It's nothing for me to do about it. Then, and it's unfortunate that you got you got scammed. But if this is something you really, really want to do, um, I, I, I need you guys to develop the mindset that, I mean, it could be something that's really trying to keep you away from um, becoming a business owner in this industry, because that's going to really be your breakthrough. That's going to really be your breakthrough. That's going to get you out of, your rut of always living paycheck to paycheck. You got to look at it, start looking at stuff that like why is this coming for me so hard? I always give the example of, I'm not a gamer, but because my nephew is, and he streams, like if you're playing a game and if you're going the right way, you have more opposition coming at you, more people shooting their gun, more people throwing their knives, blah, 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 blah. You have more opposition when you're going the right way. When you're going the wrong way, nothing's going wrong. So you got to get through whatever's coming at you so you can get to that next level. Good news to you, Savvy. What does starting a business in New York City looks like? New York currently does not have a opening for license. They don't have an opening for license. Is there a link to apply to see what grants that is available to apply for? I'm not a grant person. There are plenty of people on Facebook and Instagram to do grants, so please look them up. And the startup phase of, am I saying, is that Missouri? It's public knowledge that New York the application is closed. I've been saying that for 3 years though. So if you're just now following me, sorry. Only way you can get an agency in New York is if you buy a company, and it's probably going to run you over a cool meal. If you guys take too long to, um, if you take too long to maximize the opportunities, there's going to start to be more and more um, obstacles or restraints. Here's an example. I think maybe last week, we're on live, and someone from Massachusetts said there are rumors that they're going to start to make things more regulated. Okay. Right now, Massachusetts, Michigan, Iowa, and Arizona are our last non-regulated states. I have a whole YouTube video on non-regulated states. That means once you have your business set up, you can start operating business. That's Massachusetts, Michigan, Iowa, and Arizona. Non-regulated states operate differently than regulated states. So if someone is in a non-regulated state giving you advice on a regulated state, it's not going to be as easy because non-regulated states have no gate, right? There's no gate there. You just get licensed, and then you make sure you get into the right programs. They may still have Medicaid, they may still have private insurance, but you don't have to get licensed. So what's coming down the pike is that Massachusetts is going to become a regulated state. All of this makes sense to me because I've been telling you guys about the upcoming silver tsunami or gray tsunami. That's 2030, which we're 4 years away from, where we're going to have a massive influx of seniors, 35 and up. 70, we already said 75 is up. It's going to be at 32 million. So there you have it. There you have it. 32 million, all spread across these United States. So it's the federal government is very well aware of what's going to happen, and that's why there are so many aging in place programs starting up. So thank you for just now following me, and that was my share for today. I'm going to be getting off, so unless we have another question. And again, the nurse that I was talking to from North Carolina, don't be discouraged, Nurse Taylor, but I don't want to tell you to do all of these things when you're not doing you're not doing the first thing, right? Which is you got to get licensed. You got to get licensed. Even by us starting off this conversation, talk about healthcare government contracts or just government contracts in general, you don't have the proper structure. You're not going to be able to work with them. They want you to be in compliance. They don't want to be they don't want to work with businesses who are cutting corners or playing it safe and then thinking that once they get a government contract that now they can follow the rules. No, they don't operate like that. Okay. So, thank you so much. And thank you for sharing that. And for those of you that are on TikTok, I have plenty of free videos on my Savvy Business Chick YouTube channel. So Samantha said North Carolina was a very difficult state to get licensed, but with your videos and guidance helped me a lot. Right. So I really appreciate that. Right. So just I gotta end with, because I honestly get so many not DMs whenever I do a live. Someone is usually saying that they got scammed. Look, I'm so sorry that that has happened to you. I don't know how else to help you guys avoid scammers. And by the way, if you're on TikTok, this is my only page. I don't ask for money in my DMs. I don't do crypto. I don't do Bitcoins. This is my only page. Make sure that it's Savvy Business Chick, no dots, no underscores, right? All right, this is my only page. So I don't tell you guys to work with me or work with me only, right? We have a la carte training. We have programs that come out, a couple of times a year. We have mentorship. We have plenty of ways for you to work with me. But if you don't, make sure you pray about who you are working with, because at the point where you're saying, oh, Sean, I should have gone with you, it's nothing I can do about it. I try to give you guys these key things to look out for. There are a lot of people who only do paperwork. They only do paperwork. They're good at paperwork. They're good at completing your application. They're good at policies and procedures. But a lot of them have never operated a business before. A lot of them have never grew a business before. A lot of them have not experienced some of the highs and lows of this industry. And so they, even if they say, oh, I'm going to I can help you with that, ask them how. Ask them how. Just ask them, well, how can you help? I had someone ask me the other day, so out of the other people online, it's blah 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 blah, what makes you a good mentor, right? And in a way, I was a little bit offended by that comment. I'm like, dude, you called me twice. This is your second time calling me. This is your second time calling me. And now you telling me you want to sign up, but now you asking me to like give you some kind of presentation. I wanted to be like, go with them. Like, but you know what I did do? I said, well, my track record is that I'm always telling you guys something first. Name another home care coach, consultant, mentor that's telling you before most people what to do, how to do it, and what's really going on in the industry. If you can tell me, then I'll fold my hands and I'll stop coming on so much. Name another home care coach consultant that's telling you guys, oh, you should be doing cancer care. Oh, you should be doing postpartum care. Oh, this is what's going on with the federal government. Oh, you need to start looking into Medicare Advantage programs. Tell me. I'd like to hear, because this industry is full of gatekeepers. So, love you guys. Bye. Getting off.